Understanding folic acid. One kind of vitamin that is really important for human health is folic acid, particularly throughout several life stages like pregnancy. We'll define folic acid, explain why it matters, and discuss how to ensure you're receiving enough of it. Folic acid is what? One synthetic version of the B vitamin folate is folic acid. By another name, it is vitamin B9. Red blood cells are among the new cells that our systems use folic acid to help form. Body growth and development depend on this vitamin. Why is folic acid so important? Several essential functions of folic acid are performed by human bodies. 1. Cell growth and repair. The creation and upkeep of new cells depend heavily on folic acid. At times of fast growth, like pregnancy and childhood, this is particularly crucial. 2. Preventing birth defects. The ability of folic acid to prevent specific birth abnormalities, especially neural tube abnormalities, is widely recognized. These abnormalities arise from improper early development closure of the neural tube, which eventually forms the baby's brain and spinal cord. Women can greatly lower their chance of these problems by taking folic acid both before and throughout pregnancy. The body's red blood cells, which carry oxygen, are formed in part by folic acid. Megaloblastic anemia is one kind of anemia that can result from a folic acid shortage and can be characterized by weakness and exhaustion. Foods high in folic acid. You can take folic acid supplements, but your diet should also supply enough folate. Among foods high in folate are legumes including beans, lentils, and chickpeas, leafy greens like spinach and kale, avocados, citrus fruits like grapefruits and oranges, bread and cereals fortified, broccoli and asparagus. Who needs folic acid? Pregnant women. To lower their chance of birth abnormalities, pregnant women are frequently recommended to take a folic acid supplement. Women of childbearing age. Even if a woman is not intending to become pregnant, she should take folic acid supplements because neural tube abnormalities can arise in the early weeks of pregnancy. Those with specific medical conditions. A number of diseases, drugs, and lifestyle choices can make the body demand more folic acid. These comprise illnesses like celiac disease, certain malignancies, and binge drinking. Abenda. Important for cell growth and development as well as preventing birth abnormalities, folic acid is an essential nutrient. You may promote your general health and well-being, particularly at crucial times like pregnancy, by making sure you obtain enough folic acid from your food or supplements. See your doctor if you have any questions about how much folic acid you should be taking. Is folic acid a supplement best used by women only? Though it's not just for women, folic acid is frequently linked to women's health, especially during pregnancy. For general health and well-being, both men and women gain from getting enough folic acid. Why is as follows. General health. Folic acid is essential for both sexes in the body's creation and upkeep of new cells. In addition to promoting red blood cell production, it also promotes general health and vigor. Prevention of birth defects. Although its importance in averting neural tube abnormalities in newborns is mostly recognized, males also contribute to conception and fetal development. It may thus be advantageous to make sure that both couples have sufficient folic acid levels before getting pregnant. Other health benefits. Folic acid has been associated with a number of other health advantages, such as lower heart disease risk, mental health support, and maybe lower risk of some cancers. Men's health. Men who are deficient in folic acid run the danger of anemia, infertility, and higher heart disease risk. Men may thus also gain from making sure they are getting enough folic acid from food or supplements. Though it's usually stressed for women, especially during pregnancy, folic acid is crucial for everyone's health. Men and women alike should make an effort to keep their folic acid levels sufficient to promote general health and well-being. Speaking with a doctor is always a smart idea if you have any questions about how much folic acid you should be taking or how it affects your health. Who has to use folic acid cautiously? For the most part, folic acid is safe when taken in the appropriate dosages. However, some people should exercise caution or speak with a doctor before using folic acid supplements. Several groups of people should exercise particular caution. Those with vitamin B12 deficiency. If untreated, Vitamin B12 deficiency can cause neurological damage. Folic acid supplements can help to hide the symptoms of this condition. As such, if using folic acid supplements, anyone with a known or suspected vitamin B12 shortage should be constantly watched by a medical professional. People with specific medical diseases. The body's capacity to absorb or use folic acid appropriately may be impacted by certain medical diseases. Among these are illnesses like inflammatory bowel disease, celiac disease, and some forms of anemia. Those with these disorders could need to take larger folic acid dosages or take care of underlying problems that are preventing absorption. Those taking specific medications. The body may need more folic acid, or some drugs may prevent it from being absorbed. Among these are several anticonvulsant drugs, sulfasalazine, used to treat inflammatory bowel disease, and methotrexate, used to treat cancer and autoimmune disorders. Those using these drugs should talk to a doctor about how much folic acid they need. Pregnant women. Although most pregnant women should take folic acid supplements to avoid neural tube abnormalities, some may need larger dosages because of things like a history of neural tube abnormalities, specific medical conditions, or drug use. Pregnant women should take folic acid supplements as directed by their healthcare professional. Those with MTHFR gene variants. The capacity of the body to transform folic acid into methylfolate, its active form, can be impacted by variations in the MTHFR gene. Though more study is being done on the importance of MTHFR variations, some people with particular variants might benefit more from methylfolate supplementation than folic acid. Individual needs can be ascertained with the aid of genetic testing and medical advice. Though too much folic acid might have negative consequences, it is still necessary for health. Therefore, especially if you belong into one of the following categories, it is crucial to follow advised dosages and speak with a healthcare professional if you have any questions about folic acid supplements. For what length of time has folic acid been recommended, and has widespread use begun? Although folic acid has long been acknowledged for its value to human health, its broad application and acknowledgement really started to pick up steam in the second half of the 20th century. Discovery and early research 1930s to 1940s. Early in the 1940s, scientists discovered the value of folate, the natural form of folic acid, in avoiding anemia. Folate was subsequently isolated from spinach in 1941. Nutritional importance 1950s-1960s. By the 1950s and 1960s, folate's wider nutritional importance, including its ability to maintain general health and avoid birth abnormalities, was becoming clear to scientists. Related to 1970s to 1980s neural tube defects. When folate insufficiency and neural tube abnormalities, NTDs, in infants were linked, researchers achieved a major breakthrough in the 1970s and 1980s. This piqued curiosity in the function of folate supplementation, especially for expectant mothers. Fortification and supplementation 1990s present. Assist guarantee that women of reproductive age obtain sufficient quantities to lower the risk of NTDs. Many nations mandated the fortification of grain products with folic acid in the 1990s. Furthermore, taking supplements of folic acid both before and throughout pregnancy became a common advice in many medical standards across the globe. Research and awareness present. Studies investigating the possible advantages of folic acid in heart health, mental health, and cancer prevention are still being conducted. Furthermore, stressing the value of folic acid supplementation, especially for pregnant women and those intending to conceive, are public awareness programs. All things considered, folic acid is now widely consumed and acknowledged as an essential nutrient, particularly for pregnant and childbearing women, because it is included in prenatal vitamins and is widely fortified in grain products. More people now have access to sufficient amounts of this vital vitamin, which has greatly improved public health outcomes linked to neural tube abnormalities and other disorders linked to folate deficiency. Thank you for joining us on Herbalist channel today. We hope you found this video informative and inspiring on your journey toward better health and well-being. Don't forget to like, share, and subscribe for more videos on herbal remedies, health tips, and nutritious recipes. Remember, nature has provided us with incredible healing properties through plants, and we're here to explore them together. Until next time, Stay healthy, stay happy, and stay tuned to Herbalist channel. Take care.